KREM 2 is digging deeper tonight into the Spokane Regional Health Board after their controversial firing of Dr. Bob Lutz. After the board voted 8-4 to terminate his employment as the health officer, many have wondered why local political leaders are making public health decisions. Here's what I found out.
You know, I would really have to think about that.
It was controversial before it even began.
I'd like to make a motion that we terminate the employment with Dr. Bob Lutz.
The Spokane Regional Health Board, made up mostly of local mayors, city council members, and county commissioners, voting to remove the health district's top doctor.
Our Board of Health is a bunch of politicians.
Former Spokane City Council President Ben Stuckert is one of several local community members who have now filed official complaints with the state, saying a lack of public health experience on the board is the real problem.
We have 9 out of 12 members that have no public health background, and then they get the appointments. And so you end up with a Board of Health that's making these decisions that affect all of our health and our community, just made up of elected officials.
And Stuckert's not the only one. Maria Howard is a volunteer ethicist at the Regional Health District who has seen the county's coronavirus response from the inside.
We need to make sure to rally around people with experience in public health, with experience in medicine, so that choices being made reflect science and data.
Okay, so let's just stop right there. Who's actually on the Board of Health? Well, as of right now, it is our 3 county commissioners, the Spokane City Council president, and 2 other city council members. Then there is the mayor of Spokane Valley and 1 other Valley council member, and then the mayor of Millwood, and that's just to represent the area's smaller cities. Okay, so that's 9. Then the last 3 are community members appointed by each of our county commissioners, 1 for each district. Of these 12, only 2 have any medical or health experience. Andrea Frostad has been licensed in dental hygiene since 1989, and Dr. Jason Kinley, a licensed naturopath since 2016. Now, Kinley is also part of the anti-vaccine movement here in Washington. He also has close ties with controversial lawmaker Matt Shea, both speaking out against masks and the governor's stay-at-home orders.
And it raises the question, how much does politics play into public health decisions? And should we have more medical professionals on the health board to limit political influence? I reached out to all 12 health board members to get their side. Brienne Beggs, who is also Spokane City Council president, was the only one who responded to comment.
Do you see that as a problem?
I don't see it as a problem as long as everybody stays in their lane. But it's fine for health board members who are elected to say, you know what, I think these things are too extreme. You know, you have to balance, health with the economy. It's just that neither one should be able to censor the other.
Some cities across the country also have limited medical professionals on their health boards, but in many it is more common to find a mix of both sides. Tacoma, for example, which is similar in size to Spokane, has 1 MD who serves from the Pierce County Medical Society. Boise has 3 medical professionals on its health board, including 1 MD, a nurse practitioner, and a retired RN who serves as board chair.
Do you think that there should be more medical and health professionals on the board?
The health board's job is not to make medical decisions or speak medical things. It's to do administration and really fund the health board. We might be grumpy or disagree, but that happens all the time in government. Different people have different powers, and that's why we have checks and balances.
Are you concerned at all about politics entering into this conversation of public health and having too much influence?
I think that is always a problem when we have health crises. It just is. And you're not going to stop it. But again, as long as you empower the independent medical voices so they have an unfettered platform, then I'm less worried about it.
Spokane Mayor Nadine Woodward does not sit on the Board of Health, but shortly after members voted to terminate employment of Dr. Lutz, Mayor Woodward released this letter stating her initial reaction when she first heard the news was that it was the best news she'd heard in a long time.
Talk to me a little bit about the tone of that letter. There have been some criticisms that it seemed political in nature. What is your response to that?
Well, I wanted to express to the health board that whatever decision they were going to make on Thursday was something that I would support. and that I saw it really as an opportunity to, once again, work collaboratively with our regional partners, something that we haven't been doing for quite a while.
Dr. Lutz's attorney has since called out the mayor's letter and said the board's political and economic motivations were clear.
I think my letter also expressed a level of frustration that that breakdown has now resulted in just one agency and one person making all the decisions.
Did politics play any role in your frustrations?
Well, certainly not in mine, and certainly not in the health board's decision on Thursday night. It wasn't until we all watched that meeting that we found out what the problem was, that it was an internal conflict. That was something that we all learned, but for me, it's not political at all.
Does that concern you that we have political voices making these health decisions?
Well, I don't know much about the makeup of that board as far as how it got to where it is now. I think that's a good case. I think maybe we do need some more diverse voices on that board.
Still, she insists local political leaders have an important role in the process and that the two sides have to learn to work together.
Those kinds of messages that come from the health board or a health officer need to be relayed back to the communities by us, the electeds and the community leaders.
What do you say to the people who would question some of that and say that it should be coming from the medical professionals and not the electeds, that we've set it up that politics plays more of a role than science?
Well, I don't think necessarily that just because electeds are part of the discussion and part of the decision making, that's all political. I mean, we're a region and we need to be working together on many, many things outside of this health pandemic. I think that makes us stronger when we're working together.
In Spokane, Whitney Ward, KREM 2 News.
And after Dr. Lutz was fired, several groups spoke out against a process and decision. The Spokane Medical Society, a group of health professionals, wrote a public letter supporting Dr. Lutz.
Our investigative reporter Ian Smay is here now with more on them. Ian?
Hundreds of local healthcare professionals signed the letter, and it went on to the local health board. I spoke with the society president about balancing science with politics. Here's what he had to say.
How important is it to have public health and medical experts on that board?
I think it's really important to have medical experts on that board. I think there's certainly a role for administrators, for county people who are involved in the funding and politics of it, that look at look at healthcare in a different light. But it's extremely important to have partnership with healthcare experts. I think it would be nice if it would be a little bit more balanced. If there are 12 people on the board, it'd be nice if 6 of them were healthcare professionals and 6 weren't. I think that would be a good balance.
Dr. Pakianathan also believes the board could focus on more specific types of medical backgrounds on the board. For example, Pakianathan says it would be good if members with a healthcare background came from different specialties, such as mental health, dental, public health, and practicing physicians, just to name a few. In the newsroom, Ian Smay, KREM 2 News.